My stepmother insisted I wasn't really sick during my cancer diagnosis. The first text came through while Teresa was inserting the IV line into my port. My phone vibrated against the armrest of the infusion chair, and I glanced down to see Patricia's name lighting up the screen. I should have known better than to check it, but something about sitting in that chair with poison dripping into my veins made me crave any distraction, even a toxic one. Patricia. Just talk to Karen, whose son is an oncologist. Real cancer patients don't use their phones during chemo. Too sick. I stared at the message for a long moment, feeling the cold liquid beginning its journey through the catheter in my chest. Teresa noticed my expression change and paused what she was doing. She'd been my infusion nurse for 3 weeks now, and she could read faces better than most therapists. The vinyl chair creaked as I shifted my weight, trying to find a position that didn't make the port side ache. Around me, the oncology unit hummed with quiet activity. 15 other patients sat in their own chairs, some sleeping, some reading, some staring at nothing while their bodies absorbed chemicals designed to kill the cells trying to murder them from the inside out. My phone buzzed again, then again. The family group chat was exploding, and I knew from experience that ignoring it would only make things worse. Patricia had a talent for turning silence into evidence of guilt. I'd learned that lesson the hard way over the past 4 years, ever since Dad married her 6 months after Mom died. 4 years of watching Patricia rewrite family history, 4 years of being painted as the difficult son who couldn't accept his father's happiness, 4 years of small cuts that never quite healed before the next one opened. Dad. Patricia, please. Patricia. I'm trying to protect you from being manipulated. He's been pulling stunts for attention since I married you. Teresa finished adjusting the flow rate and caught my eye. She didn't say anything, but her hand rested briefly on my shoulder before she moved to check on the patient across from me. The woman was older, maybe 70, and she'd been getting treatment for years based on the easy way she settled into her chair. She smiled at me, that knowing smile cancer patients share when they recognize another member of the club nobody wants to join. Emma. Why are you being mean to Marcus? My half-sister. 12 years old and already braver than most adults I knew. Patricia and Dad's daughter, conceived within months of their wedding, born into a family where I was increasingly positioned as the problem child. Emma had my mother's sense of fairness, which was ironic considering she'd never met the woman. Sometimes I wondered if DNA carried more than just physical traits, if somewhere in Emma's genetic code was an echo of the person who'd raised me to stand up for what was right. Patricia. Adults are talking, Emma. I picked up my phone with shaking hands and opened the camera. The IV pole stood next to me like a metal sentinel, the clear bag hanging from it labeled with my name, and the drug that would either save my life or destroy what was left of it. Carboplatin and etoposide, my oncologist had explained. Standard first-line treatment for stage 3 Hodgkin lymphoma. I'd nodded like I understood, but all I really heard was stage 3 and lymphoma, and we need to start immediately. I positioned the phone to capture the IV pole, the bag with its toxic cocktail, and my hospital bracelet with my name printed in bold letters next to the word that had redefined my existence, lymphoma. I sent the photo to the group chat without commentary. What was there to say? The image spoke for itself, or it should have. The IV line snaking into my chest, the medical equipment surrounding me, the other patients visible in the background of the shot. But I'd underestimated Patricia's ability to bend reality to fit her narrative. I'd been underestimating her for 4 years. Patricia. Anyone can sit in a hospital and take photos. My cousin's ex did that for disability fraud. My hands started trembling harder. Not from the chemo, not yet anyway. That would come later, in the days after infusion when my body would turn against itself, trying to process what I'd voluntarily allowed into my bloodstream. This trembling came from somewhere deeper, from the exhausted part of me that had been fighting Patricia's accusations and manipulations since before I even got sick. The part that was so tired of defending my existence, of proving I wasn't the villain in her story. Aunt Carol. Patricia, what is wrong with you? Uncle James. This is disgusting behavior. The family was finally seeing what I'd been dealing with in isolation. For 4 years, Patricia had been careful to keep her worst behavior private, to position herself as the misunderstood stepmother trying her best with a hostile stepson. She'd played the victim so convincingly that even my own relatives had started questioning whether I was being fair to her. But cancer had stripped away the privacy she relied on. You can't hide chemotherapy. You can't pretend away weight loss and hair falling out in clumps and the gray pallor that settles over skin when cells are dying faster than the body can clear them away. Patricia. Oh, so now the family shows up. Where were you all when he was too sick to come to our anniversary dinner? Dad. That was last week. He was getting his port installed. Patricia. Convenient timing. Teresa appeared at my side again, her dark eyes concerned as she watched my hands shaking around the phone. She didn't ask to see what I was reading. She'd been doing this job long enough to recognize family drama when she saw it, and she'd probably seen every variation of how relatives respond to cancer diagnoses. Some families pulled together, others fell apart. Some used illness as a weapon, and I was beginning to understand that's what was happening in mine. Honey, you don't need this stress right now, Teresa said gently, holding out her hand. Your body needs to focus on healing. I let her take the phone and place it in the small drawer attached to my chair, but I could still hear it buzzing, and buzzing, and buzzing. The vibrations seemed to sync with my heartbeat, a mechanical reminder that the world outside this infusion center was still spinning, still generating conflict, still demanding my attention, even while poison dripped into my veins trying to save my life. The diagnosis had come 6 weeks ago, during what I'd thought was a routine physical exam. I'd been feeling tired for months, but I was 32 and working 60-hour weeks as a software engineer. Tired was normal. The night sweats were harder to explain away, and the swollen lymph nodes in my neck that wouldn't shrink no matter how much water I drank or how many vitamins I took. My primary care physician had felt them during the exam and gone very still, the kind of still that makes your stomach drop because you know something has shifted in the room. The biopsy results took a week. 7 days of pretending everything was fine while I Googled symptoms at 3 in the morning and talked myself down from panic attacks in the bathroom at work. When Dr. Reynolds called and asked me to come in to discuss the results, I knew. You don't get asked to come in for good news. Good news gets delivered over the phone with congratulations and reassurance. Bad news requires tissue boxes and privacy and careful explanations about treatment options and survival rates. Stage 3 meant the cancer had spread above and below my diaphragm. It meant aggressive treatment, months of chemotherapy, possible radiation, depending on how my body responded. It meant my life as I knew it was over, at least temporarily. Dr. Reynolds had been optimistic in that careful way oncologists learn to be, talking about cure rates and favorable prognoses, while simultaneously explaining all the ways treatment might fail, or how the cancer might come back, or how the drugs designed to save me might cause permanent damage to my heart, or lungs, or fertility. I'd sat in that office and nodded and taken notes like I was in a business meeting, and then I'd driven home and sat in my car for 2 hours before I could make myself go inside my apartment. That's when I should have known that telling Patricia would be a disaster. But some part of me, some naive part that still believed family meant something, thought cancer would be the thing that finally brought us together. Serious illness, I'd reasoned, had a way of putting petty conflicts into perspective. I'd been catastrophically wrong. The night I told Dad and Patricia about the diagnosis, I'd rehearsed the words a dozen times. I'd called Dad and asked if I could come over, and he'd said yes without asking why. Patricia had answered the door with Emma hanging off her hip, and I'd felt my carefully prepared speech dissolve in my throat. How do you talk about dying in front of a 12-year-old? How do you explain that the human body can turn against itself, that cells can forget their programming and multiply without purpose until they choke out everything healthy? We'd sat in their living room, the one Patricia had redecorated within weeks of moving in, erasing every trace of my mother's presence. The beige walls, the modern furniture, the abstract art that meant nothing and said nothing. Emma had been sent upstairs despite her protests, and I'd been left alone with Dad and Patricia in a room that felt like a hotel lobby, sterile and temporary. I have cancer, I'd said, because there was no gentle way to deliver that information. Hodgkin lymphoma, stage 3. I start chemotherapy next month. Dad had gone white, actually white, like someone had drained the blood from his face. He'd reached for me, his hand shaking, and I'd seen real fear in his eyes. For a moment, just a moment, I'd felt the connection we used to have before Mom died, before Patricia, before everything got complicated. Then, Patricia had laughed, and the moment shattered. "You're joking," she'd said, and when neither of us responded, her face had hardened. "This is unbelievable. The timing, Marcus. The timing is always so perfect with you." I'd stared at her, not understanding. Dad had found his voice and told her to stop, but she'd been building momentum, years of resentment finding an outlet. She'd listed every time I'd been sick or injured, reframing each incident as a calculated ploy for attention. The appendicitis that had nearly killed me when I was 25 became a convenient excuse to ruin her birthday dinner. The car accident that had left me with a concussion and 3 broken ribs was suddenly suspicious because it happened the week before their anniversary cruise. Even my mother's funeral, she'd implied, had been somehow orchestrated by me to make her feel like an outsider. I'd left that night without resolution, and Dad had called the next morning to say Patricia needed time to process. Time to process. As if my cancer diagnosis was something that had happened to her, something she needed to recover from. He'd asked me to be patient, to understand that Patricia had some trauma in her past related to medical issues, to give her space to come around. I'd agreed because what else could I do? I had cancer. I needed to focus on treatment, not on managing my stepmother's feelings. But Patricia hadn't come around. If anything, she'd doubled down. The family group chat had become her primary weapon, a way to broadcast her skepticism to everyone we knew while maintaining plausible deniability. She never quite said I was lying about having cancer, but she'd mastered the art of the insinuation, the carefully worded doubt, the concern trolling disguised as protection for my father. She'd become a phantom prosecutor, building a case against me one text message at a time. Teresa returned with a warm blanket and draped it over my legs. The infusion center kept the temperature low, something about helping patients manage the nausea, but it meant sitting for hours in a cold room while chemicals that made your body temperature regulation go haywire worked their way through your system. I'd learned to dress in layers, to bring extra blankets, to accept every small comfort offered, because the treatment itself was anything but comfortable. "How are you feeling?" Teresa asked, checking the IV site where the line entered my port. The area around it was already starting to bruise, a purple-yellow stain spreading across my upper chest. My port was still new, installed just 2 weeks ago in an outpatient surgery that Patricia had claimed I'd scheduled specifically to get out of her anniversary dinner. Never mind that the surgery date had been set by the hospital based on surgeon availability and my chemo start date. In Patricia's world, everything revolved around her. "I'm okay," I lied, because what else do you say? I'm terrified and exhausted, and my stepmother thinks I'm faking cancer for attention? That my family is imploding via text message while I sit here trying not to think about the poison in my veins? That I'm 32 years old, and I might die, and the person who should be supporting my father through this is instead tearing me apart in front of everyone we know? Teresa's expression told me she didn't believe my okay for a second, but she didn't push. She'd probably heard every variation of "I'm fine" from patients who were decidedly not fine. Instead, she pointed to the call button attached to my chair. "If you need anything at all, you press that button. I don't care if it seems small or silly. You press it." I nodded, and she moved on to the next patient. The older woman across from me was awake now, reading a paperback mystery novel with the kind of intense focus that suggested she'd learned to escape into fiction during treatment. I wished I could do the same, but my phone was still buzzing in the drawer, and I could feel each vibration like a tiny electric shock. The worst part wasn't even Patricia's accusations. The worst part was watching Dad fail to defend me. Every time she posted something in the family chat questioning my diagnosis or my timing or my motives, Dad would offer a weak "Patricia, please," and then fall silent. He never directly contradicted her, never laid out the facts, never told her she was wrong and needed to stop. His silence felt like complicity, and I was starting to understand that maybe it was. My mother would have eviscerated anyone who spoke about me the way Patricia did. Mom had been fierce in her protection of the people she loved, and she'd taught me that family meant showing up, especially when things got hard. But Mom had been gone for 4 years, and I was learning that the families she'd built didn't survive without her. Dad had seemed lost after she died, wandering through the house like a ghost, and when Patricia had appeared with her certainty and her plans, and her ability to make decisions without the paralysis of grief, he'd grabbed onto her like a life preserver. I'd tried to be understanding. I'd tried to remember that everyone grieves differently, that Dad needed to move forward in his own way, that Patricia genuinely seemed to make him happy. But over 4 years, I'd watched her systematically erase my mother from Dad's life, from our family stories, from the narratives we told about where we came from. Mom became your father's first wife, in Patricia's tellings, a character who existed in the past tense, sanitized and distant. And I became the difficult stepson who couldn't let go, who brought up his mother too much, who made Patricia feel like an intruder in her own marriage. When Emma was born, I'd hoped things would improve. A baby changes families, creates new bonds, offers fresh starts. And for a while, it seemed like it might work. Emma was beautiful and funny and smart, and I'd loved her immediately. Being a big brother gave me a role in the family that didn't require me to compete with Patricia for Dad's attention. I could focus on Emma, and everyone could be happy. But Patricia had sensed the bond between Emma and me, and she'd started managing it carefully. Visits became scheduled and supervised. Time alone with my sister required advance permission and detailed explanations of what we'd be doing. Patricia had a way of making reasonable requests sound reasonable while actually being completely controlling. "I just want to know where my daughter is," she'd say, as if I might kidnap Emma despite being her brother. "I'm sure you understand, with everything that's happened." The everything was always vague, always implied, always suggesting some past transgression I couldn't defend against because it was never clearly stated. The chemo dripped steadily into my port, and I watched the bag slowly deflate. Each drop represented hours of research, billions of dollars of pharmaceutical development, decades of clinical trials and failed experiments. The drugs going into my body had saved countless lives, but they'd also destroyed countless others. There was no guarantee which group I'd end up in, and that uncertainty was its own special kind of torture. I could do everything right, follow every protocol, endure every side effect, and still die. Or I could survive the cancer and die from the treatment. Or I could survive both and live with permanent damage to my organs, my fertility, my quality of life. My phone finally stopped buzzing. The silence felt ominous rather than peaceful, like the eye of a hurricane. I knew Patricia well enough to know she wasn't done. She was probably strategizing, reaching out to people individually, building her case in private conversations that I'd never see. She'd done it before, turning family members against me one at a time through carefully curated stories that positioned her as the victim of my hostility. Aunt Carol had been the first to break ranks, texting me privately after one of Patricia's early group chat performances. "Your stepmother is a piece of work," Carol had written. "I don't know how you've put up with her this long. It had been validating to have someone acknowledge what was happening, but it had also felt like too little too late. Carol and Uncle James and the rest of Dad's siblings had watched Patricia operate for years without saying anything publicly. They'd whispered their concerns in private while staying silent when it mattered. The nausea hit around hour 2 of the infusion, creeping up from my stomach in waves that made my mouth flood with saliva. Teresa had warned me this would happen and had given me anti-nausea medication before starting the chemo, but the drugs only took the edge off. I could still feel my body's rejection of what was being put into it, the fundamental wrongness of poison as medicine. I closed my eyes and focused on breathing, counting inhales and exhales like my therapist had taught me, trying to stay present in my body without being overwhelmed by what it was experiencing. I'd started therapy 2 months before the diagnosis, finally admitting that I needed help processing everything with Patricia. My therapist, Dr. Patel, had been the first person to use the word gaslighting in reference to my family situation. I'd heard the term before, but never applied it to my own life. Gaslighting was something that happened in dramatic relationships, in true crime podcasts, in situations that were clearly abusive. It wasn't something that happened in families, especially not in quiet ways, over years, through seemingly reasonable requests and expressions of concern. But Dr. Patel had walked me through the patterns, helping me see how Patricia consistently denied my reality, questioned my perceptions, and made me doubt my own experiences. The way she'd reframed every conflict to make me the aggressor, every disagreement to make me the unreasonable one. The way she'd convinced Dad, and eventually much of the family, that I was difficult and hostile when all I'd done was fail to perform gratitude for her presence in our lives. "You're allowed to protect yourself," Dr. Patel had said during our last session before I started chemo. "You're allowed to set boundaries, even with family, especially with family." She'd given me homework, identify my non-negotiables, the lines I wouldn't let Patricia cross anymore. But then the cancer diagnosis had come, and all my careful boundary setting had felt impossible to maintain. How do you enforce boundaries when you're vulnerable and sick and need your family's support? The answer, I was learning, was that you couldn't. Not really. Patricia had sensed my weakness and exploited it, ramping up her campaign right when I was least able to defend myself. The group chat messages, the public skepticism, the comparisons to disability fraud, all of it designed to isolate me and position her as the victim of my manipulation. It was masterful in its cruelty, and I was beginning to understand that Patricia wasn't just skeptical about my illness. She was threatened by it. My cancer diagnosis had disrupted the family narrative Patricia had spent 4 years constructing. In her story, I was the problem child who resented her happiness with Dad, who couldn't move past his mother's death, who caused drama and needed attention. But cancer changed the script. Suddenly, I was sympathetic, vulnerable, deserving of support. Suddenly, the family was rallying around me instead of around Patricia's version of events, and she couldn't tolerate it. The infusion finished around hour 4, and Teresa disconnected the IV line from my port with practiced efficiency. The area around the port site throbbed, and I knew from previous sessions that the pain would get worse before it got better. Everything about chemo had a delayed reaction. The nausea would peak tomorrow, the fatigue would hit in 3 days, the mouth sores would develop by the end of the week. It was like experiencing a car crash in slow motion, feeling each injury manifest in sequence rather than all at once. "You did great today," Teresa said, which is what she said after every session. I appreciated the consistency, even though I knew she said it to everyone. "Remember to hydrate, rest when you need to, and call the oncology hotline if you develop a fever or anything concerning." I nodded and gathered my things slowly, my body heavy with chemicals and exhaustion. The other patients were in various stages of their own treatments, some just arriving, some in the middle of infusions, some preparing to leave. We were a community bound by circumstance, strangers sharing the most intimate experience of trying to stay alive. The woman across from me looked up from her book and gave me a small smile, the kind that acknowledged we were both in the same fight. Outside, the afternoon sun felt aggressive after hours in the dim infusion center. I'd driven myself to treatment because Patricia had made it clear she wouldn't be providing rides, and Dad had to work. The independence had seemed important when I'd made the decision, but now, walking to my car with legs that felt like water and hands that shook when I tried to unlock the door, I regretted not asking Aunt Carol or Uncle James for help. I sat in the driver's seat for a long moment before starting the car, checking my phone for the first time since Teresa had taken it. 63 messages in the family group chat. I scrolled through them with a sense of dread mixed with morbid curiosity, watching the conversation devolve from Patricia's accusations to family members taking sides to increasingly personal attacks that had nothing to do with my cancer anymore. Patricia had pivoted from questioning my diagnosis to questioning my character, bringing up perceived slights from years ago. The time I'd been rude to her mother at a holiday dinner. The birthday present I'd given her that she'd claimed was passive-aggressive. The way I'd always referred to Emma as my half-sister instead of just my sister, which she interpreted as rejection of their family. Every grievance she'd been storing for 4 years came pouring out in a wall of text that painted me as a manipulative narcissist who would fake cancer to maintain my position as the victim in our family story. And some people were buying it. I could see the likes accumulating on her messages, family friends and distant relatives who didn't know me well enough to question her narrative. The pile-on effect of social media, where whoever speaks most confidently and most persistently shapes the perceived reality, was happening in real time in my family chat. By the time I'd finished scrolling, Patricia had successfully reframed my cancer diagnosis as the latest episode in my campaign for attention, and I was too exhausted to fight back. I drove home slowly, probably slower than was safe given my diminished reaction time, and made it to my apartment without incident. The building was a modern complex in the suburbs, one-bedroom units filled with other young professionals who worked too much and knew their neighbors' names but nothing else about them. I'd moved here after Mom died, needing distance from the house where I'd grown up, from the memories soaked into every wall. My apartment was exactly as I'd left it that morning. Clean, organized, impersonal. I'd never bothered decorating properly, never hung pictures or picked out furniture that reflected any kind of personality. It had always felt temporary, like I was waiting for my real life to start. Now, looking at the beige walls and generic couch and empty bookshelves, I realized this was my real life. This was what I'd built in the years since Mom died, and it was hollow. I collapsed onto the couch and finally allowed myself to cry. The kind of crying that comes from somewhere deep and primitive, where you're not sad about any one thing, but about everything simultaneously. The cancer, the treatment, Patricia's cruelty, Dad's silence, the loss of my mother, the family that had dissolved in her absence. I cried until my chest hurt and my head pounded, and the nausea from the chemo mixed with the physical exhaustion of grief. My phone rang, and I almost didn't answer, but it was Emma's number, not the family group chat, and I couldn't ignore my sister. I wiped my face and tried to sound normal when I said hello. Marcus? Emma's voice was small and scared. Are you really sick? Like really, really sick? Yeah, kiddo, I am. But I'm getting treatment and the doctors think I have a good chance of getting better. Mom says you're lying. She says you're trying to make Dad choose between you and her. Emma paused, and I could hear her breathing, working up courage for the next question. Are you lying? The question gutted me. 12 years old, and she was already being trained to doubt, to question, to see manipulation in places it didn't exist. This was what Patricia was teaching her daughter, that people can't be trusted, that illness is suspicious, that family members are capable of extraordinary deception for attention. I'm not lying, Emma. I have cancer, and I'm scared, and I wish none of this was happening. But it is happening, and I need to focus on getting better. Can I see you? After your treatments? Mom says I can't because you might be contagious, but I looked it up, and cancer isn't contagious, and I just want to see you. I'd love to see you, but you need to ask your parents first. I don't want to cause more problems. Everything's already a problem, Emma said, and she sounded so much older than 12. Mom's angry all the time now, and Dad just hides in his office, and everyone's fighting. I hate it. We talked for another 10 minutes before Patricia's voice cut through the background, demanding to know who Emma was talking to. My sister hung up quickly, without saying goodbye, and I sat holding the phone long after the call ended. Patricia was isolating me from Emma, using her parental authority to control access, and there was nothing I could do about it. I had no legal rights to my sister, no way to enforce a relationship that Patricia could cut off at any moment. The next morning brought the nausea Teresa had warned about, rolling through my body in waves that made eating impossible and breathing difficult. I spent most of the day in the bathroom, vomiting until there was nothing left, and then dry heaving while my abdominal muscles screamed. This was the part of chemo no one prepared you for. The way it made you feel like you were dying while supposedly saving your life. The way every cell in your body rebelled against the treatment, trying to expel the poison even though the poison was necessary. Dad called in the afternoon while I was lying on the bathroom floor waiting for another wave of nausea to pass. I let it go to voicemail, unable to find the energy to perform wellness for his benefit. He left a message asking me to call back, saying we needed to talk, his voice careful and strained in the way it got when Patricia had given him a script to follow. I called back that evening, after the worst of the nausea had passed, and I'd managed to keep down some water and crackers. Dad answered on the first ring, and I could hear Patricia in the background, her presence hovering even though she wasn't speaking. How are you feeling, son? Like I have cancer and just had chemotherapy, I said, too tired to soften it. Patricia and I have been talking, and we think maybe you should consider getting a second opinion about the diagnosis, just to be absolutely sure before you put your body through all this. I closed my eyes and leaned, my head against the wall. I have a diagnosis from Dr. Reynolds, one of the top oncologists in the state. I had a biopsy. I have a treatment plan developed by a team of specialists. What second opinion do you want me to get? Patricia knows someone whose nephew is a doctor. Is he an oncologist? I don't think so, but he could review your files, give us his perspective. Dad, I have cancer, stage 3, Hodgkin lymphoma. This isn't a misdiagnosis or a mistake. The biopsy confirmed it. The scans confirmed it. Multiple doctors have confirmed it. What exactly do you think a second opinion is going to tell us? Silence on the other end, and I could imagine Patricia standing next to him, her face tight with disapproval at my tone. Finally, Dad spoke again, and his voice was quieter. Patricia's concerned. She thinks maybe the doctors are being overly aggressive with treatment, that there might be other options. Patricia isn't a doctor. Patricia doesn't have access to my medical records. Patricia doesn't know anything about my diagnosis, except what she's decided to believe, which is apparently that I'm lying for attention. That's not fair. She's trying to protect our family. From what? From me? I'm the one who's sick, Dad. I'm the one going through treatment. And instead of supporting me, Patricia is telling everyone I'm faking it, and you're standing there letting her. I'm not letting her do anything. I'm trying to keep this family together, and you're making it very difficult. I'm making it difficult. I'm the problem. Got it. I was crying again, angry tears that burned hot down my face. Do you know what happened during my infusion yesterday? Do you know what your wife was texting to the entire family while I sat there with poison dripping into my veins? She showed me the messages. She's upset because she feels like you're manipulating the situation. Manipulating what situation? I have cancer. How is having a potentially fatal illness manipulation? The timing, Marcus. You have to admit, the timing of your diagnosis. Right before Patricia and I were planning to what? To go on vacation? To celebrate your anniversary? You think I timed getting cancer to inconvenience you? I was shouting now, past caring about staying calm. You think I walked into a doctor's office and requested a lymphoma diagnosis because I wanted attention? That's not what I'm saying. That's exactly what you're saying. That's what Patricia's saying, and you're agreeing with her because it's easier than admitting your wife is cruel and you're too weak to stand up to her. The line went silent. Then Dad's voice came back, cold in a way I'd never heard from him before. I think we need some space. Both of us. This conversation isn't productive, and you're clearly not in a place to discuss things rationally. I'm dying, Dad. I'm literally fighting for my life, and you want space? You're not dying, you're being dramatic. The doctor said you have a good prognosis. The doctor said I have a chance. That's different from a guarantee. And I need my father right now, but apparently, Patricia needs you more. This isn't about choosing. It's exactly about choosing. And you've made your choice clear. I hung up before he could respond, my hands shaking so hard I dropped the phone. The silence in my apartment felt oppressive after the call ended. I'd just essentially ended my relationship with my father, possibly permanently, and I couldn't bring myself to regret it. Some part of me had been waiting for Dad to defend me, to tell Patricia she was wrong, to choose his sick son over his wife's feelings, but he hadn't. He'd asked me to consider a second opinion, to validate Patricia's skepticism, to prove my illness was real enough to deserve his support. The following week brought my second round of chemotherapy. I drove myself again, arriving at the infusion center early because I had nowhere else to be. Work had given me medical leave, my friends had slowly stopped reaching out after I'd canceled plans one too many times, and my family was imploding via text message. The cancer was isolating me more effectively than any quarantine, turning me into a ghost in my own life. Teresa greeted me with her usual warmth, but I could see the concern in her eyes when she noticed I'd lost more weight. The chemo was doing its job, killing cancer cells along with healthy ones, and my body was paying the price. My hair had started falling out in clumps, collecting in the shower drain and on my pillow. I'd shaved it all off 2 days ago, standing in front of the bathroom mirror with electric clippers, watching years of growth fall away in uneven patches until my scalp was bare. "How are you doing?" Teresa asked while setting up the IV, and I appreciated that she actually seemed to want an answer rather than just performing caregiver small talk. "I don't know anymore. Some days I think I'm handling it okay, and other days I can't remember why I'm bothering to fight. That's normal. Treatment is hard, and it sounds like you're not getting much support at home." I'd told Teresa bits and pieces about Patricia during previous sessions, enough for her to understand the family situation without overwhelming her with the full saga. She'd listened without judgment, occasionally offering the perspective of someone who'd seen hundreds of families navigate cancer diagnoses. "Some families pull together during illness," she'd said during my first infusion, "and some families fall apart. There's no predicting which way it'll go until you're in it." My family had definitely fallen into the second category. The group chat had continued its implosion over the past week, with Patricia escalating from questioning my diagnosis to actively trying to prove I was lying. She'd called my oncologist's office claiming to be my sister and requesting my medical records. The office had, obviously, refused, and had called me to report the attempted breach of my privacy. I'd been horrified, but not surprised. Patricia had crossed so many boundaries already that adding HIPAA violations to the list felt almost expected. She'd also started contacting my friends, people she'd met a handful of times at family events, asking them if I'd ever seemed like someone who would fake an illness. Most of my friends had either ignored her or responded with confusion, but a few had actually engaged, and Patricia had used their responses as evidence. Even his own friends admit he's dramatic and needs attention, she'd posted in the group chat, attaching screenshots of conversations taken out of context. Aunt Carol had finally had enough and removed Patricia from the family group chat, creating a new thread without her. The move had been satisfying for about 30 seconds before I realized it meant Patricia would now escalate to individual conversations, spreading her version of events in ways I couldn't see or counter. She'd already started, based on messages I was getting from confused relatives asking me to explain what was really going on, as if the truth was somehow hidden beneath layers of deception. The second infusion went smoother than the first, probably because I knew what to expect. The nausea still hit hard. The fatigue still made my bones feel like lead, but the fear was less intense. I was learning cancer's rhythm, the way treatment moved through my body in predictable cycles. Days 1 through 3, acute misery. Days 4 through 7, gradual recovery. Days 8 through 14, something resembling normal. Then back to the infusion center to start over. Uncle James visited me at home during week 2 of the second cycle, bringing soup from a local deli and staying, even though I was too tired to be good company. We sat in my living room, him doing most of the talking, telling me stories about Dad as a kid that I'd heard before, but didn't mind hearing again. Eventually, he got to the point of his visit. "Your father is making a mistake," James said, setting down his coffee mug. "He knows it, but he's too proud to admit it. Patricia has him convinced that acknowledging your illness means admitting she was wrong, and he can't do both. So he's choosing her being right over me being sick. In his mind, he's trying to keep his marriage together. He lost your mother, and the thought of losing another relationship terrifies him. So I have to lose him instead. I'm not defending him. I'm just trying to explain his thinking, which I agree is completely wrong." James leaned forward, his elbows on his knees. "Your mother would be ashamed of how he's handling this. She'd have had Patricia's bags packed within an hour of that first text message. The mention of Mom made my throat tight. I'd been avoiding thinking about her, about how she would have reacted to my diagnosis, to Patricia's behavior, to Dad's complicity. Mom had been the gravitational center of our family, the person who held everything together through sheer force of will and love. Without her, we'd all just spun off into our separate orbits, colliding occasionally, but never truly connecting. I miss her," I said, and James nodded. "We all do, but especially you and your dad. You two lost the person who mediated between you, who translated your different languages. Without her, you don't know how to talk to each other anymore. He's not trying to talk to me. He's trying to choose Patricia over me. Because Patricia makes him feel needed in a way he hasn't felt since your mother died. Your mom was strong, independent. She didn't need your dad so much as she chose him. Patricia needs him, or at least she's convinced him she does, and that neediness feels like love to someone who's desperate for purpose." I understood what James was saying, but understanding didn't make it hurt less. Dad had found a replacement for Mom, someone who looked to him for decisions and validation, who made him feel like the leader of the family he'd never quite been when Mom was alive. And I was the inconvenient reminder of his previous life, the son who looked like Mom and remembered Mom and refused to let Patricia rewrite our family history. The third round of chemotherapy came with complications. My white blood cell count had dropped dangerously low, leaving me vulnerable to infections that my compromised immune system couldn't fight off. Dr. Reynolds had prescribed daily injections of filgrastim to stimulate my bone marrow, and I'd learned to inject myself in the stomach, pinching skin and pushing the needle in while trying not to think about what I was doing. The injections caused bone pain, a deep ache that felt like my skeleton was trying to expand inside my skin. I spent days curled up in bed, unable to find a position that didn't hurt, taking painkillers that barely touched the discomfort. This was the part of treatment no one talked about, the accumulating damage, the way each round was harder than the last, the question that lingered in the back of your mind about whether you could keep doing this. Emma had started texting me secretly, using a friend's phone so Patricia wouldn't see. She'd send me pictures from school, updates about her life, questions about my treatment that I tried to answer honestly without scaring her. She'd become my lifeline to the family I'd lost, proof that not everyone had been convinced by Patricia's narrative. "Mom's been really weird lately," Emma texted one night. "She keeps talking about you like you're a bad person, but you're my brother and you've never been mean to me. I don't understand why she's acting like this." I didn't know how to explain adult dysfunction to a 12-year-old, how to convey that sometimes people create narratives that serve their emotional needs regardless of truth. So I just told her I loved her, and that none of this was her fault, and I hoped that was enough. The turning point came during my 4th round of chemotherapy. I was sitting in the infusion center, Teresa adjusting my IV, when a woman I didn't recognize approached my chair. She was maybe 50, well-dressed, and she had Patricia's eyes. "Marcus?" she said, and I nodded warily. "I'm Patricia's sister, Diana. We've never met, but I've heard a lot about you." My stomach dropped. Here was another Patricia ally, probably here to tell me I was tearing the family apart, or that I should apologize, or that I needed to stop manipulating everyone. Teresa noticed my tension and positioned herself protectively near my chair, ready to intervene if needed. "I'm here because I need to tell you something," Diana continued, sitting in the empty chair next to mine. "Patricia called me last week, crying, saying you were faking cancer to hurt your father. She wanted me to help her find proof that you were lying." "Okay," I said carefully, unsure where this was going. I didn't believe her. Patricia has a history of creating drama, of seeing conspiracies where none exist. So I did some research. I called your oncologist's office pretending to be coordinating care. I looked up Hodgkin lymphoma survival rates. I even drove by this infusion center to see if you were actually coming here for treatment. My hands clenched into fists. Another person violating my privacy? Another family member treating my illness like it needed independent verification? And I'm here to apologize. You're clearly very sick and my sister is clearly very disturbed. I've been enabling her behavior for years, making excuses for her, but what she's doing to you is inexcusable. Diana pulled out her phone and showed me a series of text messages between her and Patricia. In them, Patricia admitted she knew I probably had cancer but couldn't stand the attention it brought me, the way it made her look bad for not being supportive, the way it disrupted her carefully constructed family dynamic. She'd written, in explicit terms, that she'd rather I be lying about cancer than actually be sick because at least if I was lying, she could be right. I stared at the messages, reading them over and over. Patricia knew. She'd known from the beginning that my diagnosis was real, and she'd chosen to tear me apart anyway because her need to be right, to be the victim, to control the narrative, was stronger than basic human decency. "I'm going to send these to your father," Diana said, "and to anyone else who needs to see them. What Patricia's doing isn't just cruel, it's pathological, and she needs professional help. Why are you telling me this? Why not just send them? Because you deserve to know that you're not crazy, that you're not overreacting, that your perception of what's been happening is accurate. Patricia is very good at making people doubt themselves, and I wanted you to hear from someone in her own family that she's the problem, not you." Teresa had been, listening to the entire exchange, and after Diana left, she sat down next to me and took my hand. "That woman just gave you a gift," she said. "She gave you proof that you're not the villain in this story. Don't waste it by feeling guilty about how your family's going to react." She was right. Diana's messages were evidence, concrete proof that Patricia's campaign against me was intentional and malicious. But holding proof felt different than I'd expected. I'd spent months wishing someone would see through Patricia's performance, would validate my reality, would acknowledge what she was doing to me. Now that it had happened, I felt empty rather than vindicated. Because proof didn't change the fundamental reality. My father had chosen Patricia's version of events over his own son's lived experience. He'd let me go through chemotherapy alone, let me fight for my life without his support, let Patricia tear me apart in front of our entire family, and no amount of evidence would undo that betrayal. Diana sent the screenshots to Dad that evening. I know because he called me at midnight, crying so hard I could barely understand him. He apologized over and over, saying he'd been blind, that he'd failed me, that he couldn't believe what Patricia had said in those messages. He begged me to forgive him, to let him make it right, to give him a chance to be the father I deserved. I listened to him cry and felt nothing. No relief, no satisfaction, no renewed love, just emptiness, where my relationship with my father used to be. When he finally stopped talking, I said very clearly, "I'm glad you know the truth now, but knowing the truth doesn't undo the damage. You let your wife torture me while I was fighting cancer. You asked me to prove my illness was real. You asked me for a second opinion on a diagnosis that was killing me. I don't know if I can forgive that. I'll leave her," Dad said desperately. "I'll file for divorce tomorrow. I'll do whatever it takes. This isn't about Patricia. This is about you. This is about the fact that when I needed you most, you weren't there. You chose comfort over courage, and that's not something that can be fixed with grand gestures." I hung up before he could respond, and I turned off my phone for the first time since my diagnosis. The silence felt holy, like the world had finally stopped screaming at me. I slept for 14 hours straight, the kind of deep, dreamless sleep that only comes when your body has permission to stop fighting. The final 2 rounds of chemotherapy passed in a blur. Dad showed up at my apartment repeatedly, leaving flowers and food and handwritten letters that I didn't read. Patricia, according to Aunt Carol, had been removed from all family events indefinitely and was claiming she'd been taken out of context, that Diana had manipulated the messages, that everyone was ganging up on her. She'd started her own group chat with the few relatives who still supported her, creating an alternate reality where she was the victim of a family conspiracy. Emma came to visit me after I finished my last infusion, Patricia finally relenting under pressure from Dad and the rest of the family. My sister brought me drawings she'd made, stories she'd written, a scrapbook of photos of us together over the years. We sat on my couch and watched movies, and she didn't mention Patricia or Dad or anything about the family implosion. She was just there, and that was enough. 3 months after my final treatment, Dr. Reynolds told me I was in remission. The scans showed no evidence of cancer, and while I'd need regular monitoring for years to come, the immediate threat had passed. I'd survived, both the cancer and the chemotherapy, though I wasn't entirely sure which had been harder to endure. Dad and I started therapy together, family counseling sessions where we sat in uncomfortable chairs and tried to rebuild something from the wreckage. It was slow work, painful work, the kind of work that required me to hold him accountable, while also acknowledging that people were complicated and relationships were messy, and love didn't mean never failing the people you cared about. Patricia and Dad separated 6 months after the screenshots came out. Emma stayed with Dad most of the time, and I got to be the big brother I'd always wanted to be. Patricia sent me one message after the separation. "I hope you're happy now." I didn't respond. Her happiness or unhappiness had stopped being my responsibility the moment she'd decided my cancer was less important than her ego. A year after my diagnosis, I stood in Aunt Carol's backyard at a family barbecue, watching Emma play with her cousins. My hair had grown back curly, a side effect no one had warned me about. and I'd regained most of the weight I'd lost during treatment. I looked healthy, normal even, but I knew the truth that every cancer survivor carries. You're never entirely well again, never entirely free of the shadow of what almost killed you. Dad approached me carefully, holding 2 beers, offering me one like a peace treaty. We stood together in comfortable silence, and eventually he spoke. I don't expect you to forgive me completely, but I hope you'll let me try to earn it. I took the beer and watched Emma execute a perfect cartwheel on the grass, her laughter carrying across the yard. I'm letting you try, I said. That's all I can promise right now. He nodded, and we stood there as the sun set, 2 men learning how to be family again after everything had burned down. It wasn't the ending I'd imagined when I was first diagnosed, sitting in Dr. Reynolds' office trying to process the word lymphoma. But it was real, and it was mine, and somehow that was enough. Thanks for sticking with me all the way. If you liked this, hit subscribe and drop a like so you don't miss the next wild story.